Hey everyone, and welcome. Our motto here is pretty simple. Don't take this without understanding it first. This is your go-to guide for medication, and today we are diving deep into a really common one, lyrica. You know, our whole philosophy is just that. We truly believe you should never put a medication in your body without having a solid handle on what it is, what it's supposed to do, and, just as importantly, what you need to watch out for. It's all about empowering you to take charge of your own health.
Okay, so let's get right to it. You've probably heard the name lyrica thrown around. Maybe you or someone you know has a prescription for it. But what is it really? Let's break it all down.
To really get the full picture, we're going to walk through 6 key parts. We'll kick things off with the basics, then cover what it's actually used for and how it works. After that, we're getting into the super crucial safety info, and trust me, there's a hidden danger in there you'll want to know about. And finally, we'll tie it all together with what this means for you.
So, first things first. Lyrica is really just the brand name, the marketing name. The actual drug, the chemical that's doing all the heavy lifting, is called Pregabalin. At its very core, Pregabalin's job is to deal with problems in your nervous system. You can almost think of it like a dimmer switch for your nerves. When nerve signals are firing way too much, causing things like pain or seizures, Lyrica steps in to turn down the volume.
So, what specific issues is this dimmer switch used for? Well, it's actually used for a bunch of different things, from very specific kinds of pain all the way over to anxiety. Now, if you look at the official FDA-approved uses, you'll see it's for several types of nerve pain. That's pain from damaged nerves, like what you can get from diabetes or shingles. It's also officially approved for fibromyalgia, which involves that chronic all-over pain, and as an extra add-on therapy for some types of seizures.
But here's where it gets interesting. You won't find this on the official label, but it's prescribed off-label all the time for generalized anxiety disorder. And why is that? Well, studies have found it can be pretty effective for both the mental and the physical feelings of anxiety, so it's become a common alternative to other anxiety meds.
Okay, let's peek under the hood a little. How does this stuff actually calm everything down? The way it works is a little surprising, and it actually explains a lot about its most common side effects. So Lyrica's chemical structure looks a lot like a natural calming chemical in our brains called GABA. But plot twist, it doesn't actually interact with the GABA system. Instead, it goes after these little things called calcium channels on your nerve cells. By blocking them, it stops those nerves from releasing so many pain or anxiety signals. It's literally just telling those overexcited nerves to quiet down. All right, let's shift gears to something that is incredibly important. Any medicine that's powerful enough to help you also has the potential for side effects. So let's get into what you absolutely have to know about Lyrica. Just take a look at these numbers from the clinical trials. The top side effects are dizziness and sleepiness. And honestly, that makes total sense, right? If the drug's whole job is to turn down the volume on your nervous system, it's no wonder it can make you feel a bit drowsy or off balance. I mean, look at the jump compared to people taking a sugar pill. Swelling, especially in your hands and feet, is another big one to watch for. Now, we have to talk about the most serious risks. And I'm going to be really deliberate here. This is a direct quote from an FDA safety warning. Respiratory depression means your breathing can slow down to a dangerous, even fatal level. It is not common, but it's so severe that you have to be aware of the possibility. So the most important thing to know is when this risk shoots up. The danger gets much, much higher when Lyrica is combined with other drugs that also slow down your system. We're talking about things like opioid painkillers or anti-anxiety meds like Xanax. Having lung problems to begin with, or being elderly, also really increases that risk. This is another really critical warning that the FDA puts on this whole class of drugs. For about 1 out of every 500 people, taking this medication can cause suicidal thoughts or behaviors to appear or make existing ones worse. It's absolutely vital that anyone taking it and their family keeps an eye out for any sudden changes in mood or behavior.
And this brings us to a huge point. You cannot just stop taking this medication cold turkey. Your body gets used to having that dimmer switch on. If you suddenly switch it off, your system can go into overdrive. This can trigger a whole host of withdrawal symptoms, from anxiety and insomnia, all the way to really serious stuff like confusion or even more seizures. The only safe way to stop is to slowly, gradually reduce the dose with your doctor's guidance.
Okay, now we're going to talk about something really fascinating and frankly a little scary. It's a hidden danger that can happen with Lyrica and a lot of other drugs right out in the open. It's something called a prescribing cascade. So what the heck is a prescribing cascade? Think of it like a chain reaction. You start taking drug A, and it gives you a side effect. But Instead of recognizing it as a side effect, your doctor thinks it's a totally new health problem. And what happens when you have a new health problem? You get a prescription for drug B to treat it.
Here's a perfect real-world example from a study. So a patient gets prescribed Lyrica. We already know that a common side effect is leg swelling, but the doctor sees the swelling and thinks, looks like a fluid retention issue. They don't connect it back to the Lyrica. So what do? They prescribe a diuretic, a water pill. Now the patient is on a whole new medication with its own set of risks just to treat a side effect from the first one.
And how often does this kind of thing get missed? This is the really shocking part. The study that looked at this exact situation found that for the veterans who went through this, their doctors almost never even considered that the swelling might just be a side effect of the pregabalin. It's a cycle that's so easy to fall into, but it can be really harmful. So all of this brings us to the most important question. What does this mean for you? Understanding all these facts and risks is great, but what can you actually do to protect yourself?
Look, the bottom line is you have to be an active player in your own healthcare. So here's your checklist. First, know those common side effects we talked about: dizziness, sleepiness, swelling. Second, please never stop taking it suddenly. Third, make sure your doctor knows about everything else you take, even vitamins, to avoid bad interactions. And maybe most important of all, if a new symptom pops up after you start a new drug, always ask that simple but powerful question. Hey doc, is there any chance this new thing could be a side effect from my medicine?
And that really leaves us with a much bigger question to think about. That prescribing cascade shows just how easy it is for one pill to lead to another and another. So how can we, both as patients and as doctors, get better at seeing the whole board and tracking these hidden domino effects? That's definitely something worth chewing on.